Well, Dr. Bobby Long from Magnolia Veterinary Hospital is with us, and we're taking your calls and comments at 1-888-539-8859. And we're going to start up down in Anderson with Ashley. Hi, Ashley.
Hi, how are you?
Doing good. How are you doing?
Great. I was calling in regards to a pet my grandmother owns. She has a tomcat that she's grown attached to in the past few years. And recently the cat's been sick, so she took it to a veterinary clinic and had blood work done on it. The blood work came back with everything normal. However, the cat is not eating or drinking. And so we were looking actually at the lab reports today, and it looks like he lost over a pound in a week.
Yeah.
So and she was telling us today that he threw up the other day, and the throat was black.
Mm-hmm.
So my mom and I were kind of wondering if it's possible that he has some sort of internal illness, maybe a cancer, that the blood work wouldn't be showing.
Yeah, I mean, blood work's not necessarily going to show cancer now. How old do y'all think he is?
Oh, I have no clue.
Okay.
Oh, my mom's saying that he's 7.
He's 7, okay. And is he inside all the time?
I think he's primarily been sort of an outside cat. He would kind of come inside at night or during the winter when it got cold.
Yeah.
But spent most of his time outdoors.
And is he? Now you said tomcat. So is he a neutered male or is he an intact male?
I don't think he's been neutered.
Okay.
He's not been declawed, so I'm kind of assuming she wouldn't have him neutered either.
Okay.
Well, I mean, there's a lot of things. If the blood work's okay on him as far as like kidney values and things like that, then you do worry about it with, especially if he goes outside and he's an intact male, things like feline leukemia, which, if they knew he was an intact male and outside, more than likely they probably would have tested him for that. But there's other things that cats can get sick with that may not necessarily produce changes in the blood work. You mentioned cancer, some types of cancer, like some types of lymphomas, like intestinal lymphoma, things like that may not show up. Just inflammatory bowel disease may not show up. But then the other thing is if she took him and blood work was okay right now, but then he's still sick and he goes for a period of time without eating, cats are kind of unique. Well, cats and horses are unique in the way that they mobilize fat to use for energy. And so they actually, their little process as far as breaking down that fat, sending it to the liver to utilize or to make energy out of is really probably a little too efficient. So if they're anorectic and they're not taking in enough calories, then over a period of it can vary from 3 or 4 days with some cats to 7 to 10 days with other cats. They can start developing what's called hepatic lipidosis. So they can get, and that's something where they get really, really sick. And unless you treat them, and try to get those calories in there, it sometimes means putting a feeding tube in for a little while, things like that, then that doesn't reverse. So if he's not getting better, then definitely I'd take him in and let them, check him over. And they may want to repeat the blood work. Actually, if it's been a week or so, they might want to repeat the blood work to see where it is now. But there definitely are, some things that can go on that may not show up on blood work.
Yeah.
And if he wasn't checked for the infectious diseases, that's a really, really big thing.
Yeah. It's the feline leukemia.
Yes.
Yeah.
Well, feline leukemia and FIV,
Okay.
but feline leukemia is a lot worse than the FIV is.
FIV. Yeah. So
Okay.
so the fact that he's not eating is bad. The fact that he's not drinking is really bad.
Yeah.
In my opinion. Yeah.
And then when they vomit, if it's dark that comes up, if it has a foul odor to it, because dark can be a couple of things. One is if we've got something where we're getting some bleeding in the stomach acid a lot of times will turn it kind of a dark brown, and their vomitus kind of looks like coffee grounds. The other thing is that if we've got an obstruction of some kind, like an intestinal mass, or whether he ate something he shouldn't have, as it gets worse, then they will vomit and it'll be a dark color and it'll be kind of a fetid or fecal odor to that vomitus. And so that's a pretty important emergency too that we need to get him in as soon as possible.
She also mentioned that he had a bowel movement that was particularly foul in odor. So,
yeah. And then there's some, just bugs too that they can get that can cause GI tract colitis, gastroenteritis, things like that. And so, I definitely think that if he's not better, even though nothing showed up on the blood work, that it's worthwhile taking him in because I don't know what all was done, but it sounds like there could be some other things they could look into too.
Right.
Okay,
Ashley.
And,
Okay.
She was kind of wondering if an X-ray would be a productive venue to pursue. However, it doesn't sound to me like that would be the case. What would your opinion be?
Well, most of the time on cats, a lot of times how we determine that, as far as if we want to jump in and do an X-ray to start, or somewhere early on, is how that abdomen feels as far as when you palpate and you feel, because cats are thin, so a lot of times you can get a good feel of whether there's any thickened intestines, whether there's something you think might be a mass, whether it's really gassy. You can kind of get a feel for what's in there a lot of times on your physical exam, and so that's usually when you decide whether to take the X-ray or not. But certainly with vomiting, included in the presenting signs,
right,
an X-ray probably would be one of the things that would be in the diagnostics.
Right.
Okay.
Okay.
All right. Well, thank you for your time.
Yes, ma'am.
Thanks,
And
Ashley.
good luck.
Thanks for calling in.